Senator Raphael Warnock, thank you very much. Appreciate it. And thank you for preaching vaccine, people getting the vaccine when you go home on the weekends. We appreciate that. Joining us now, former acting CDC director, now president and CEO of the Robert Wood Johnson Foundation, Dr. Richard Besser. Dr. Besser, we're going to get the latest on COVID in a moment. But first, you wanted to weigh in on Senator Warnock's push to close the Medicaid coverage gap.
Well, you know, Mika, we are the only wealthy nation that doesn't guarantee health care as a right. And one of the ways that we can move towards universal health care is by ensuring that all 50 states have expanded Medicaid. You know, the Affordable Care Act really created incentives for states to increase the number of lower income people who had access to Medicaid. Medicaid is the largest health insurer in our nation. But even with federal incentives, 12 states have said no. You can ask those states why, but they've said no, and that means that 2.2 million people directly have not benefited from that. Largely, you know, hardworking families, disproportionately people of color, 60% people of color. We know that Medicaid expansion leads to better health outcomes, fewer premature deaths, better economic activity because people have more dollars in their pocket to spend in the local economy. And that's not taking place. And so we need the federal government to step up and make this happen. There are many ways that they can do that, but it's got to get done.
Okay, the senator is pleased to hear that. And I want to now move on to COVID and the CDC and the messaging from the government. Some say it's been a bit mixed as of late. What do you make of that? And what is your advice to Americans in terms of, you know, where things stand in terms of COVID and the danger it poses to our lives and livelihoods?
Yeah, you know, there is some promising signs. The number of cases of COVID is going down across the country. The number of hospitalizations, the number of deaths are going down. The gap in vaccine coverage is closing for some groups. There's been some terrific data presented by Kaiser Family Foundation that shows that among adults in America, the rate of vaccination, first vaccine dose for Black Americans, white Americans, Latino Americans is all roughly about the same, right around 70%. And that's terrific. It shows that if you really meet people where they are and address some of the challenges, some are challenges in terms of access, and some are challenges in terms of trust in government and government institutions, that you can see improvement. But there still are gaps, especially an urban-rural gap. There's a gap by political affiliation, which means that there are big pockets in the country that are still quite vulnerable. When it comes to the holidays, what I think we have to realize and reckon with is that the virus is going to determine what we can do. And, you know, I hope that we can all gather with our families, with our loved ones. That's so important. We've been so isolated as a nation. And I'm going to be planning for that. But I'm also going to be planning for the possibility that the virus has other plans. And we have to be ready for that. Mm-hmm. You know, we will not have vaccines for young children. We may have vaccines for you know, elementary school children, but that's still to be determined. We have to see what the advisory committees say. So there still will be a lot of people who are vulnerable, and so we can't go back to pre-pandemic days, but hopefully it will be a better winter, a better Thanksgiving and holiday season than it was last year.
Dr. Besser, when you assess how we're doing as a country, obviously we've come to terms with the fact that there is a percentage of the population that's never going to get vaccinated. They've been given FDA approval. They've been given people in their communities, football coaches, senators, who've told them that's the right thing to do and not going to go get it. But when you see spikes in places like New England and Massachusetts and Vermont with high vaccination rates, what does that tell you about the Delta variant? What should we be thinking about there? Because some of the ICUs up in that part of the country are now filling up again.
Yeah, you know, what it says to me is that the concept of herd immunity, that we can reach a certain level and we won't see transmission, is really not attainable. I really don't think so. And what it says is that even in areas with high coverage rates, what you do individually really matters. And I've been very pleased and encouraged by the impact we're starting to see with some of the vaccine mandates that are in place. Businesses that are saying, you know what, if you want to work here, you have to be vaccinated because I want my entire workforce to be safe. And if you're not vaccinated, you could put someone in the workplace at risk, someone who may have a medical condition where the vaccine didn't work effectively. And so if you want to work here, you have to be vaccinated. I think we are seeing some benefits from that. And as the activities that people want to do are limited by their vaccine status, I think we're going to continue to see some movements in that. But, you know, the New England data say to me that even in places that have in place a lot of controls, we are all still vulnerable, and we have to take this seriously.
Former acting director of the CDC, Dr. Richard Besser, thank you very much for coming back on the show this morning.